Welcome, everyone. It's a great pleasure to have you all with us today for this wonderful panel event. My name is Frederick Worley. I am Assistant Dean of Academic Design and Innovation at UC Berkeley Global and have the great privilege to welcome you all today on behalf of our Dean, Diana Wu, who is the architect of this wonderful event. Unfortunately, she regrets she's not with us today due to an unforeseen emergency. And doesn't that just perfectly resonate with all of us who are working hard, improvising every day, reinventing ways how we do our jobs, how we interact with our colleagues, our families, and friends ever since this crisis has started? The initiative of this event and the many others that we are running and organizing almost every week now is born out of a need of our institution to continue our mission to serve the people, to provide opportunities to learn, to access excellent, outstanding thought leaders, and to provide a forum to people from all walks of life, really, and from also around the world to connect and exchange their respective perspectives, their experiences, their best practices, their research, their visions for what is to come, and how maybe to better deal with the situation, and particularly how to successfully move into this new normal after the COVID-19 crisis. Today, we have the unique opportunity to gain insights from two renowned thought leaders on the role of journalism in this global pandemic. And I want to thank both panelists very, very much for having taken the time to be with us today. We have first Ed Wasserman, Dean and Professor of Journalism of the Graduate School of Journalism at UC Berkeley. And we have John Swartzberg, Clinical Professor Emeritus of Infectious Diseases and Vaccinology, faculty of UC Berkeley and UCSF Joint Medical Program, and editorial board chair of UC Berkeley Health and Wellness Publications. I will let you both introduce yourself to the audience, and after that, I propose that we jump right into the discussion of this very exciting topic. To our audience, please feel free to share your questions at any time. We have a team of moderators that will structure the questions so that the panel can address them throughout the discussion. So if that's all right with you, maybe we can start with you, Ed, and you could share with the audience right away your perspective on the current state of the media with respect to this pandemic, and maybe focus on the good sides of it and what you're particularly satisfied with.
Well, thank you, Frederick, and thanks to Diana for bringing this group together. It's a wonderful topic and a chance to reflect on what the media have been doing well and doing poorly in this during this unprecedented set of challenges is something that is really worthwhile doing, because it directs the media and it enables us to get some distance on what the media are doing, and also get some distance on the way that media are shaping popular thought about the conditions that we're in and are kind of guiding this sort of vast challenge to social awareness that we're confronted with. To set the table just for a moment, I think it's important to appreciate just how novel this set of challenges is. I have really never seen, I've been in journalism since the early 1970s, and I've never seen a story that has as many perplexing and nettlesome dimensions to it as this one does. The velocity of the story is extraordinary. The complexity of the story and the disparate ways it's impacting on society is kind of without precedent. The intensity of interest in the story and the potential consequence of the ways in which it's being presented and the failures in the ways in which it's being presented are really kind of massive. And I have to also say that for those of you who don't follow the world of the media as closely as some of us do, it comes at a time when the media have really never been quite as ill prepared to handle. I mean, the media have been in a circling the drain for almost a generation now, buffeted by the loss of advertising revenue and the destruction of the historic model by which commercial media were sustained. So you're looking at a news media complex that's probably 40% weaker than it was a generation ago in terms of bodies it can put in the field to actually try to tackle a difficult story. So this is an interesting moment, and in many ways it's a make or break moment for the media. That I just wanted to set that up as a kind of to set the stage a little bit for the conversation that we're going to be having this morning.
Thank you so much. John, what is your perspective on the current state of the media, you from this epidemiological perspective, and also with a particular know-how of how scientists interact with journalists?
Sure. Well, I think our listeners might be asking the question, what does an infectious disease specialist in public health have to do with being on this, with this august group with Ed? I've had the good fortune of being the chair of the editorial board of the UC Berkeley Wellness Letter and the UC Berkeley Health After 50 newsletter now for 20 years. And that's afforded me the opportunity to spend a lot of time with journalists, get to know them very well, get to know their strengths, their weaknesses, just like they get to know my strengths and my weaknesses. So after these 20 years of education, it's brought me to this point in my career where both my experience in journalism and my 40 years of experience in infectious disease have come together at this one moment in time. And as Ed was saying, this one really unique moment in time. It's unique from the journalist's perspective, and it's also unique, of course, from the perspective of public health and infectious disease. It's important to remember, although I think we all know this, that this virus has not been around a long time in the human species. Probably sometime late November, early December, it first emerged in our species. This is called a spillover event from an animal. In this case, it was a bat. And it's led to what we all know is a complete disruption of our society, and even more importantly, so much morbidity and so much mortality. 4 months, 5 months is not a long time to get to know this creature and to how it behaves in our species. And as a specialist in infectious diseases, my colleagues and I, we are struggling to learn how to deal with it. Just like journalists are struggling to learn how to present it to the public. And I think the emergence, the confluence of these two phenomena at this one time make this topic very interesting and terribly important.
So with respect to this interaction between journalists and scientists, what is both of your take on the responsibility actually of journalists or the media in driving the development of this pandemic with the public, but also maybe with policymakers?
Well, I wanted to, that's a very interesting question. Obviously, the easy answer is that the responsibility of journalists is to get it right. But this is a particularly perplexing challenge in a setting where the nature of knowledge is under daily revision and daily redevelopment. And journalists are being put into a very uncomfortable position of being essentially the conduits through which very specialized knowledge creators, researchers are talking with each other. And it's generally speaking, and I would welcome John's perspective on this, but generally speaking, journalists will wait until research has ripened to the point where it's been vetted and it's been peer reviewed and it's appeared in established journals, and they have some entitlement to rely on that as credible sources. It's gone through a very careful editing process. Now what we're seeing is research findings that are kind of half-baked from the perspective of accepted protocols are being seized upon because they have potential clinical importance in the way that people who are sick are going to be treated. And things are being, in historical terms, prematurely disclosed. And we're relying on the news media to operate as what are essentially very specialized channels of communication and providing knowledge and informing people who are in the field and are then taking their own cues on directions of their own research from the accounts that they're getting from from journalists, and which is a little bit, it's good in that it's a nimble system. It's a very responsive system. It's not so good when you end up with distortions and misleading things, and material that should be looked at with great skepticism is instead being embraced, seized upon, and possibly even applied long before it's ready. So I'm just wondering, I'd be curious to hear John's perspective on at what point the media are doing their job in seizing on things that people need to know about, and at what point are they giving undue and undeserved emphasis to knowledge that's really not very well vetted and very well established.
Well, it's a really important point you raise, Ed. And interestingly, it's not just journalists who are struggling with that. I struggle with that. My colleagues struggle with this all the time during this pandemic. And the reason for that is that researchers are now publishing in what's called preprint journals. That is, they're publishing their results before the material has been vetted by peer review and before it's been published in a journal. These preprint journals are very challenging. We saw this just yesterday when an excellent group from Los Alamos suggested that the virus has changed and it's more contagious. At least they're positing that. This data is already being challenged as of 24 hours later as to how important it is or how accurate their data is. So what is a journalist to do? But what is a scientist to do when the society as a whole is being bombarded with this kind of information? You know, there's another challenge for public health people and for journalists as well, and that is journalists represent a critical tool always for society in terms of getting information out. I look at it from my perspective as a public health professional. I sit around and talk with my colleagues. We think together here at UC Berkeley, but how does that information get to the public? It gets to the public by journalists. So the responsibility we at the university have in terms of trying our best to dissect the information and give the best opinion we can, then we count on the journalists to translate that to the public. This has become even more acute today when the information we get, for example, from the White House is confusing at best and often prevarications. So we're torn, the society is torn between information from the government that cannot be consistently trusted. So journalists become even more critical in this role.
Yeah, that's a very interesting. I'm glad you brought up the question of authority and credibility in news sources, because that has been another very perplexing dimension of this story. Journalists, for good or ill, journalism has always deferred to authority when it comes to assigning credibility to information. And you naturally, when you learn something, you hear something, your first impulse is that, well, let's find the people who are really in a position to be authoritative on this, and the people we have a right to trust, and the people who, by the way, we can hold hold them accountable if they fail to honor that trust. But so we would typically go in a national emergency, you would typically turn to the national government. And yet, time and again, we're dismayed and baffled by the kind of incoherence and lack of reliability of the information we're getting. And we're seeing information that should be fairly politically neutral is instead being spun in ways that we can't trust. So this is a huge problem in determining what information is worth sharing with the public. And it's also, I would say, just logistically raises a tremendous problem, because what has happened the authority and the most interesting and the initiative and the dynamism in the public sector has been overwhelmingly coming from the states. And here you're talking about an area of the media news complex that has been particularly devastated by the cuts in financing over the last, say, 10, 20 years. Our coverage of state governments in this country has never been more pathetic than it is now. And where you used to have, and where I used to live for many years in Florida, you might have had 15 or 20 reporters covering state government in Tallahassee. You've got 2 or 3 now. So, and I think you've had similar cutbacks. California is lucky because Cal Matters is taken up in Sacramento, and it's a nonprofit news organization that's doing very good work. But California, Texas, a few other places have had nonprofit response to that. But for the most part, our ability to cover state government with the kind of attention that it now deserves has never been weaker. So I guess I'm opening what I'm really wanting to hear from you a little more about is who deserves to be regarded as authoritative, and how do we as journalists know? And we're redeploying, we're moving around pawns on the chessboard right now. We're taking sports reporters and putting them into healthcare, and we're putting them into scientific labs, and we expect them to be able to learn and to be able to convey this information in a coherent and understandable and intelligible way. But what do we do with a situation where there's no clear playbook that tells you who you can rely on? And even scientists, we're not sufficiently sophisticated to understand the kind of incentives that scientists have now to spin their own findings in ways that might position them for greater notoriety or greater grants and all the rest of it. So we're entering into another world that unless you're a science or medical reporter, you're really not accustomed to. So I'm just wondering, I'm just trying to, from our perspective, the informational universe we need to inhabit and to negotiate and to understand is tremendously fraught with complexity.
Well, Ed, I think, what it comes down to, like in everything in life, is relationships. And I've really noticed this during the pandemic. Many of my colleagues and I have established relationships with journalists. They know that they can trust what we're saying. So they'll often come to us for an opinion about someone else's work. Not that necessarily we have the right answer, but they know we're going to be able to give them at least a consistent answer and a thoughtful one. And they don't just ask us, of course. A good journalist is going to ask multiple people who they have relationships with, who they trust. And by doing that, they often can come down to they can arrive at a pretty good perspective on how this particular new research fits into the context of what's happening with the pandemic. There's another aspect of a challenge to the journalist in terms of this relationship, and that is they've got to deal with this idea of false equivalency. They need to be able to have a perspective on when it's not necessarily that there are two opinions on something. There may be variations of one opinion, but they're not necessarily two diametrically opposed opinions. We've seen this in politics, where the journalists often get trapped between, well, this person said this and this person said that. Look at the anti-vaccine movement, for example. Or look at these, bring it more to this pandemic, look at the protesters about the freedom to go back to work, the freedom to expose more people to the virus in actuality. Well, this is false equivalency, that there may be 200 protesters in California and 36 million people here, close to 40 million people. So journalists have to contend with that as well. And it's been really interesting during this pandemic to, at least locally here in the Bay Area, to look at the journalists' work. And I think they've done a pretty good job with that on the whole.
So I'm curious, if let's take the question, those burning public policy question now, which is how much to reopen and under what guidance. And I'm wondering whether, in your view, the way that question has been framed is respectful of the science, sufficiently respectful of the science, or has that conversation been hijacked by a set of other policy principles, beliefs about the direction of the country, the greatness of America, all of these other kind of somewhat softer but strongly felt ideological currents within the society? And because we always say, well, let's follow the science. The progressive view now is let's listen to the science. Well, in your view, has this conversation been sufficiently heedful of what the science is telling us to pay attention to?
Well, of course, it depends upon who you're reading or who you're listening to. Again, I'll turn to the Bay Area. I think the reporting in regards to that question has been quite good. One of the traps I see, and I see journalists falling into in general, in general, has been this idea that the question is binary, that the question is either we open up society or we stay sheltering in place. And when questions are framed that way, I think journalists make that sets them up for failure. The nuanced question, of course, is we all want to get back to work, and yes, we have to leave sheltering in place to some extent, but it's how much and when we are going to do it, and by what tools are we going to use to guide us in that process. You know, if we look at what's happening now with the debate about this, we have a few states in the United States that have opened up their societies, having people go back to work. Texas is a good example. Your old state of Florida is another example. Georgia is sort of the poster child of this. Interestingly, those three states have done some of the least amount of testing to understand where they are in the pandemic, how many people are infected, how many people have been infected. These states, interestingly and ironically, are amongst the least prepared to monitor the effects of people going back to work. They won't. So essentially, these states are flying blind. They don't know where they've been, and they don't know where they're going. And the only way that they're going to understand the consequences of their action is when people start appearing in the emergency rooms in great numbers, where hospital beds are being used up, where ventilators are no longer available. These are the kind of problems that will take place when officials don't follow a reasoned policy, if not a binary policy of either keep everything closed or keep everything open. And again, coming back to journalism, the journalism that I listen to, the journalism that I read, and again, I'm going to refer to the Bay Area journalism because I speak a lot to these folks. I think they're getting it quite right. They're not trapped into this binary picture. They're much more capable of looking at the nuance of the issue.
It's actually quite interesting. We're getting reactions from the audience about this type actually of events and the type of contribution that we can make with respect to are we actually allowing people to kind of build their own judgment and build their own ideas and learn actually, or are we trying to tell them what to do? One interesting perspective that I think you have touched upon both that might help people better understand this dynamic is that if you go a little bit deeper into the profile of the journalist and the scientist, you see that both actually have pressures and specific biases to be active in this pandemic. So Ed, you were hinting towards the fact that journalists, well, they need to publish something and they need to publish something new all the time. That's their job. What can you report if there's nothing really to report or nothing safe to report? And John, you were hinting towards the fact that, well, scientists as well, for them it's a huge opportunity as well as an incredible threat. If your labs are closed, what research are you going to do? And at the same time, right now, this is the time to actually get into a position where you're in the spotlight, you could maybe increase your visibility, your citation rates, and so on. So there's kind of this weird mix between incentives to act and to publish, to report. At the same time, there's also an probably unprecedented impact that you have by doing so. So I don't know if you could maybe help the people, the audience, understand and learn from this feedback that you can give on how they should react to this, both the publications from scientists and journalists, with this insight into what is actually happening with both.
I think, you raised, that's a big question. The nature of knowledge for a journalist is different from the nature of knowledge for a scientist. And what is newsworthy to a journalist, which is high praise, how that ties out to public significance and the kinds of things that people should know about. And, we're all very mindful of the fact that the media are in the business of providing things that are fresh and different and interesting, that sometimes they will look for an angle that's kind of novel, even if it's not, even if it's very exceptional. And there's always the problem that news does focus on the exceptional at the expense of illuminating underlying realities that continue and don't change from day to day. And that's part of the pact with the devil that journalists assign. So the fear is that disparate impacts, for example, which is a big underlying problem. The fact that this condition, all of the impact, all of the consequences of this pandemic are felt very, very differently depending on where you are in the society and how much money you have and what color you are and how recently you got to the country and whether you have papers. And there was a big surge of coverage about the death rate among African Americans, for example. And so the fear is that after that surge of coverage, that story goes away because editors will say, well, we know that. Tell me something I didn't know. And rather than, well, let's explore that more deeply and let's look at exactly what the consequences are and how that ripples through to children and to various other parts of people's activities. So I would say that the thing that I worry about when journalists are superintending this process of social awareness is that news values will trump questions of significance. Rather than amplify and deepen our understanding of what's going on, they may lead us to be skating on the surface longer than we should. So I think that's a genuine fear, particularly at a moment when news media are kind of struggling to maintain audience and to keep audience and keep interest, and they're dealing with a lack of resources and just consistent evidence of shrinkage in the news business. So these pressures are on them as well. So I guess the larger question, the larger issue that I'm pointing to, and maybe that's where you were going with this, is the ways in which just conceptually what's newsworthy and what's important, those two worlds may diverge. And that's a problem.
And Ed, you really point out a tremendous distinction between the profession of journalism and the profession of scientists. In science, nature has her secrets, and science is the best tool that humans have discovered to unravel those secrets and use them to help our species and hopefully help the world. But that process of science is so different than the process of journalism in the sense that it is slow, it is methodical, it has to be both. It's almost ponderous at times because you have to be so careful. Those secrets are given up. Nature seems to hold on to those secrets with such tenacity that we have to work so hard to get them. And we have to be so careful in our assessment of them. I look back to 1918, 1919 with the influenza pandemic. And those were times even worse than ours, much worse than ours. And scientists were proceeding slowly and methodically, and it was driving people crazy that science couldn't give them the answer. But science can't do that in a rapid way. And this is this process, trying to fit it into the process of journalism to communicate that, is a tremendous problem. It's a difficulty, and that the good scientists and the good journalists seem to are those that can really merge those two in a way that the public can learn from the process, but not be frustrated at the same time.
Well, I want to hear you talk a little more about this, because this is really very, very interesting. You are describing science as a means by which knowledge is created. And certainly at its finest, that's what science is all about. It's unearthing and explaining realities in ways that are valid and true. But science also exists as a mechanism of social intervention. And here we're trying to, it's kind of the difference of the house is on fire, you got to put out the fire. And then we'll talk about means of new measures of fire prevention down the line, and the science of how fires come about. And it's not unreasonable for the journalist to be the expression of that yearning on behalf of society for science to mobilize itself, and if necessary, to relinquish some of its well-established principles of verification and authenticity and all the rest, in order to just tell me what you've got. And that's an important pressure. And if the journalist is an instrument of that pressure, I'd say that's probably a pretty good thing. And the other thing is this, I just wanted to, you mentioned the 1918 flu epidemic. In the early 1980s, I was a supervising editor at the Miami Herald when the AIDS epidemic was really breaking. And I remember very clearly at the this would be about 83, 84, and the CDC's guidelines for risk factors for AIDS, right, consisted of male homosexuals, intravenous drug users, hemophiliacs, and Haitians. Right? This was, I tell people this and they're stunned. Being Haitian was a risk factor for AIDS. Now, I don't know, this was coming from the scientists. And I guess there must have been good evidentiary basis for that. But obviously the social consequence of that stigmatizing of Haitian people as being essentially plague carriers had massive consequence in terms of discrimination and disadvantaging an already disadvantaged population. So I guess we need to be humble, and I'm ready to get in line with you, alongside you, in praising science. But we also want to be mindful of where are the areas where science is likely to be found to be wrong, and that are nevertheless, these preliminary findings are taking on a certain significance in driving policy. And I wonder, because we need to know, you can say, yeah, I'm all for science, but which science, and subject to what kind of constraints, and can it be heedless of consequence?
It's I'm smiling when I'm listening to you, because when I speak with journalists, they sometimes, not infrequently, make me uncomfortable, because they're pushing me to say, okay, we know what science knows right now, but what would we do? What should we be doing right now? What opinion can you give the public based upon your knowledge of where science is? And that's where I become very uncomfortable, because I'm no longer standing on secure ground. But yet, it forces people who are doing this kind of work to make judgments without the kind of data that we're used to having. And that's where the disquiet comes from. And yet, if it's not going to come from the scientists, the people who are spending their days and nights now thinking about these problems and trying to figure them out, then where is it going to come from? So this becomes a major role for the scientist, for the academician, to work with the journalists to get this information out. What the public needs to understand is that these opinions that they're going to get from people like me and my colleagues are not necessarily going to be right. The science is going to change in the next 2 or 3 weeks. We're seeing this all the time now, and we don't get it right all the time. So I appreciate when the journalists frame it in such a way that's saying, well, this is what we know now, and this is what Dr. So-and-so has to say about it. But, you know, going a little further with this idea that you're talking about, journalists actually have played a really important role, play an incredibly important role in terms of pushing us to look at things we're not looking at, the academicians to look at things we're not looking at. For example, here in the Bay Area, there was the sports teams in the Bay Area, the San Jose Sharks and the Warriors were playing, continuing to play in spite of the fact that the public health officials were asking them, please stop having fans come to your games. I wasn't thinking much about that. My colleagues weren't thinking much about that. We were thinking about other issues that had to do with trying to discover what nature was all about, what this animal SARS-CoV-2 was all about. It was the journalists, I remember, who I got a call from one of the journalists, actually from the sports page at the San Francisco Chronicle, who said, do you want to comment on this? And I did. And some of my colleagues did as well. Well, it was the journalists that brought that to the area's attention. And this ultimately, journalists nationally have now brought this to the attention of the public, of what our sports teams were doing, bringing thousands of people together for a prolonged period of time in an enclosed area in the face of a pandemic that spreads primarily by respiratory droplets. What an insane thing to do. And it wasn't just here in the Bay Area, it was throughout the United States, and it just wasn't the United States. Multiple countries were having the same problem, including the Olympics and the International Olympic Committee. And all of these issues didn't come from academicians identifying problems. These issues came from journalists identifying the problems, asking academicians to comment on that. And so it's our relationship during this pandemic, our meaning journalists and scientists, our relationship has to be hand in glove. And I've been pleased that for the large part it has been.
I think you're muted.
He's still muted. While he's muted, maybe I can go on.
I can't hear you.
Oh.
You're being very discreet. They don't hear you. Okay. Well, we'll carry on till we get you back.
So go ahead.
I think, John, your point, that's a very, very interesting, it's a dimension of what the media do that sometimes goes insufficiently noticed. And it is allowing the people who kind of the opinion makers and the elite to talk to itself. And you know, the typical example, say, out of Washington is, well, how does the State Department know what the Treasury Department is up to? Well, Treasury Department doesn't send memos to the State Department. They don't talk to each other. What they do is they talk to the Washington Post. And so the State Department will learn about what's happening elsewhere in government from the media. And oftentimes, much of what we look at as news is a conversation going on between elements of the elite, if you like, of the people who own and run the country, talking to each other. And we, as the public, eavesdrop on that. And we listen in on that. We find out what directions, what policy directions are being talked about or being formulated. And here, the interesting challenge now is that we are dealing with some hyper-specialized factions, if you like, of the elite, if you like, of the very best of the knowledge creators in the scientific community. And we have a problem in that we in the media don't understand the underlying science very well. we are relying, we don't necessarily understand the motives of the people we're talking to. Sometimes they're high-minded and all the rest, but sometimes they're also, they've got, institutional pressures of their own that they're trying to cope with. And yet we're supposed to translate this and assign significance to it, also under a very, very fierce deadline pressure, because this story is changing all the time. People are dying every day. They're following wisdom that we purvey and propagate. And sometimes we are not in a position to ascertain for ourselves independently that this wisdom is actually wise. So it's a very interesting and very challenging moment.
It certainly is. I don't know if we can hear from our moderator now.
Yeah,
Go
I
ahead.
think I'm back. It's actually interesting, exactly the point that you were going towards, and then piggybacking on some of the questions that we have. I was wondering if you could give a few examples of where it worked well. That we have questions from people that are from the side of the scientists and as well as from the side of the journalists, asking, okay, so what can we do? I'm a journalist that is not necessarily trained. Is there a way you can maybe give a few examples that would illustrate how they should go about finding the right expert? And on the other side, we have scientists saying, well, there is among the scientists also really the people that focus more on being able to provide the accurate data and to be as accurate as possible and not necessarily pushing for pre-publication and being out there as much as possible.
That is in talking to journalists, I've really appreciated how difficult it is for them to find the people that are most appropriate for them to talk to about a particular issue. And my advice to the journalists would be to, when you have a relationship with one particular academician who that seems to be a working relationship, ask them who they would recommend you speak with or that they speak with. And that's often a good way of finding somebody else in the field. And once you get another name, then of course it can start to popcorn. You can start to find multiple names from those people. And you can create your own stable of people that you can rely on and that will respond to you. Ed was bringing up the news cycle, and that's something that academicians aren't used to. But it's clear that when I get an email or a phone call from a journalist, they need you to be available to them within a few hours usually, or at least a day or so. And that's something that I think academicians also aren't used to, but we have to appreciate their problems as well. And I really want to go back to encouraging the investigative nature of journalism, and encourage the listeners here who are journalists to think through that. That becomes such an important tool for public health. Here in the Bay Area, the antibody testing for this virus to see who's been exposed in the past, who was infected, who has antibodies to it now. This is an area that investigative journalists have looked at. One in particular here in the Bay Area who was working with me, she was the one who brought this issue up. She asked me, what about these antibody tests? I told her what we knew and what we know at the moment, and that is that so many of them are falsely positive. And she went out and found some labs that were advertising for the antibody tests where they were not well verified. They were only internally verified. And not only that, the conclusions that the laboratories were making about the antibody tests were that if you have antibody, you're immune and you don't have to worry about being infected, which is absolutely wrong and is giving not only the wrong message, but a dangerous message because people could think that they are immune when they may not be. This was done purely by the journalists who used some science. They used people who knew about the science of the antibody testing, but they're the ones who uncovered that story, and they're the ones who protected patients' lives. So, I really look at this relationship between what's going on in academia and what the public and how the public learns the journalist is the key person in the middle of that. Otherwise, how is the public going to know what they need to know? And then in a democracy, we need an informed public to make the right votes. And how are they going to be informed without good journalism?
I strongly agree. Obviously, and just to put in a plug for for Berkeley Journalism, we soon after the pandemic broke, the people who are leading our investigative reporting program, David Barstow and Geeta Anand, both very experienced journalists with multiple Pulitzer Prizes between them, worked out a partnership arrangement with the New York Times so that we had at one time 80 journalists, 80 students under the direction of about a dozen and a half lecturers and faculty members who are doing stories, working on reporting for the Times. We've had about 23, 24 stories already in the Times, which was very eager to enhance and deepen its coverage of California. So we were very eager to run after this story, even though we were mindful of the risk of some that we were taking, and we were very careful to try to limit exposure. So I take John's point about the journalists doing their job zealously. But I want to sort of tweak this a little bit, because I'm going back now to the question of deferring to the scientists. And we're hearing that now from politicians, and the ones that we think are sensible and are the people that we trust are saying, well, I'm going to listen to the science. The science, not so good. The track record for the science, not so good. The testing, the reason that we don't have enough testing seemed to have been a problem with the scientific adequacy of the testing procedures that were being proffered early on. And we have this grotesque inability to surveil our own society, which seems to derive from some scientific failures. And so I worry about that. And we're now buffeted by findings and statistical projections and the like coming from scientists that many of us can't make sense of because we don't have the quantitative skills, but also are oftentimes, when you do boil them down, they are in a great they conflict with each other. So science is not giving us the kind of unambiguous guidance that we can then hold policymakers, take them to task if they don't follow it. So, and I'm wondering, I guess where I'm going with this, I'm wondering whether the scientists are self-regulating. Are they aware that they themselves are one of those causes of policy level uncertainty, and that their inability to police their own ranks, and now we're rushing scientific findings into print in ways that could be self-seeking, self-serving, profit-seeking, in all kinds of kind of nefarious ways that the journalist is not in a very good position to know about, but you guys are, because you understand your own industry, you understand the strictures under which your labs run, and I'm wondering whether you are doing the self-reflection, the self-monitoring that would be helpful, would feed the journalism, and also would avert some of the policy levels errors that we may be stumbling into, such as reopening prematurely in a way that kills tens of thousands of people.
Well, that's a very provocative question you're raising, and a terribly important one too. Scientists are human beings, and there's some wonderful scientists and there's some real stinkers, just like other human beings. So there's the whole spectrum. And again, this comes back to relationships that journalists have with scientists, with academicians. And that relationship is so critical for saying, well, I don't know how good so-and-so's work is. What do you and your colleagues know about that? And we could say, well, this person always publishes stuff that isn't quite as solid as it should be. Just to give them a perspective on that. But, I think you're maybe creating a straw man when you say science has the answers, but that because some scientists are less scrupulous than others, that's going to lead us to poor policy. Scientists, this is the good policy is like blind people feeling an elephant. And scientists are feeling a part of that elephant. And they're telling you exactly what that piece they're feeling is, precisely because that's how they're trained. But the whole elephant, that is the whole good policy, isn't going to come and shouldn't just come from scientists. It has to come from scientists as well as people who've trained in policy, as well as people who think about, who can translate what the public's thinking about, journalists as well. It has to come from all elements of society. And this comes down to leadership. And it comes down to thoughtful leadership. And this then comes down to in a democracy, it comes down to the tremendous responsibility of the electorate to elect good leaders who can look at science and understand enough of it, who can look at other pressures in society. For example, right now, what are the economic pressures? I mean, if people don't have any money, they can't buy food. And if they can't buy food, they don't live. So there are lots of contingencies that a thoughtful person who we elect has to process and try to make the best decisions possible. So scientists are only a piece of that.
No, I agree with that. But I wonder if I could push you to talk more specifically about the ways that you think science is not sufficiently guiding the currently most important question, which is, what does reopening look like? And how do you time it? And what are we hoping to see 6 months from now? And part of this has got to be based on expectations of behavior of the contagion. And I'm just wondering, do you see are there times when you're listening to this conversation about policy directives when you just throw up your hands because it's plain to you that that the conversation is ignoring obvious, prudent, well-established scientific insights, and people are forging ahead as if there's no scientific knowledge to take account of? I'm just curious about how you view that, because we all have our own perspectives, but I wonder what yours is as a scientist.
Sure. I talked about that earlier when we were talking about the states that are opening up without any data and without any tools to assess where we are or where they're going. That's a perfect example of where we know that's not the right way to go about that. If we had a population that was 60, 70%, 80% immune to this virus, then opening up would make a lot of sense. We've got a population now that maybe 3 to 5% of the population maybe is immune to this virus. And we don't even know how long they're going to be immune. So we know that the vast majority of people in the United States on this planet are still susceptible to getting infected with this virus. And we know the virus spreads so easily. So this is what the remaining hairs that I have, I pull them out when I hear these states doing these kind of things without any data at all and without any ability to measure where they're going. So that's a perfect example of where I get very frustrated, where people who, it's like the Cassandra in the Greek mythology. It's like we know the truth, but nobody listens to us. So that's a perfect example, Ed, of what you were asking about.
So do you think, let's go back to the role of the media, have the media, in your view, done enough to reflect the concerns that you're raising now? Or have they paid too much attention to 100 cars in the streets of Austin honking their horns and saying, freedom for Texas or whatever? I mean,
yeah, right. So I've got to be careful because the media that I read, I think, has done an excellent job. And of course, I'm selecting the media I read because I like what I'm hearing. So I have to be very careful with that. I've pushed myself to try and read media that I'm not normally interested in, but I find it very painful to do. I don't, for example, Fox News. I just can't bring myself to watch it. But they're going to present a different side, not based upon any way I know of this world working. So when we say media, I have to be careful when I talk about media because it's the piece that I know. But Ed, I wanted to go back to something else you were saying about what our School of Journalism has been doing with the New York Times, which I think is just fabulous. The group asked me to speak to those 80 journalist master students about the hazards of going out into the workplace. And I talked to them about what we knew and how they could protect themselves. And when you and I were talking previous time, you brought up the point that, and you've mentioned today that we don't have as many bodies to throw out at a problem. But journalists do need to speak in person often to people. This is a unique time for journalists in the sense that it's dangerous to go out there. I'm going to ask you now, what do you think that the impact of this pandemic is having on our ability, the journalist's ability to really get the story right?
Well, it's enormous. And what it does is, at its worst, it further deepens the marginalization of certain populations. The people you can't reach at their desk by phone or by social media. And if we're doing a story on the impact on farm labor, for example, it means that we have to send people out to the field. We try to be very scrupulous about adhering to a checklist of precautions people have to take. And we're also mindful of the possibility that we could be bringing contagion to them. The overall effect is obviously, look, we train people to go to the story. That's part of what a reporter does. When you hear the gunfire, you go towards, you go toward it, not away from it, because you're trying to report on the conflict. And so the fear is that it will it'll further marginalize, and there'll be parts of the story that are very hard to get, and they're very time consuming. There's a story that the reporters at the school are working on now, having to do with speakers of a language in Oakland, native speakers from Guatemala. It's a language, a Mayan language. They don't have translators for that, and they don't speak Spanish or English. And so so you can imagine the complexity of getting that story. And it's an important story. 15,000 people, they're not getting good health information because nobody can speak their language. It's crazy. Imagine what and it's taken weeks to get that story nailed down because we're not eager to push people out the door. We're very mindful of our obligation to our own students and all the rest of it. So the most obvious thing is that it encourages journalism to stay within well-worn reporting channels, to go back to sources they've worked with before, they know they can get, and they can turn things around quickly enough to satisfy a fairly ravenous appetite for news. And I think that's a problem.
Yeah, and you bring up the invisible people within our society, and that's such a terrible issue. And frankly, the scientists, the academicians are not necessarily always going to be the ones who are going to point out who's invisible. I think the journalists, it's an obligation that our journalists have to try and identify those folks as well. And again, I'll come back to the Bay Area. I think that the reporting here in the Bay Area has been pretty good on the homeless issue, on the people in nursing homes, people incarcerated in jails. These are people who are otherwise invisible. And this is an area that public health is very concerned about because we've seen the ravages of this virus in nursing homes, for example, and we're seeing it in the homeless population, and we've seen it spread in jails. And of course, it's not going to stop in those places. So it's of interest to everyone in this society, even if we don't like to see the things that are invisible. And journalists have a necessary and important responsibility in making them visible and making the rest of us aware that our fellow man is suffering. So just more kudos for good journalism here. and something that I, sitting here at the university, or actually now I'm sitting at my home, of course, can't do.
I'm actually wondering to what extent you could say that through this crisis and the limitations that it sets and the pressures that come from it, that out of it might come actually a better way of reporting on scientific facts. Because at the end of the day, if this goes on, can't we expect that scientists will be able to identify the good journalists, and journalists will be eventually able to better identify the right sources of information. At the same time, the bloggers, the non-trained journalists, or just thought leaders, self-declared thought leaders on social media, having to stay at home, will not be able to produce information on their own. So are we in a process of kind of almost evolutionary selection towards better reporting now?
Well, I think this is a fabulous opportunity for breaking down silos. We have a nascent program at UC Berkeley in journalism and public health where you get a dual master's degree. Unfortunately, there hasn't been much funding for that. But it's a perfect example of where a journalist equipped with understanding epidemiology, with understanding biostatistics, with understanding principles of public health, a journalist equipped with that knowledge could rise right to the top of his or her profession, with a lot of hard work, of course, added to that, because those are tools that journalists could really use. So, you were asking about some of the salutary things that could happen with this pandemic. From an academic standpoint, maybe it could help break down some of these silos and lead to more cross-fertilization of thinking and training. And I'd be really curious what you think about that.
Well, it's a very hopeful scenario. I mean, my own somewhat more jaundiced observation would be that when you ask a student to do a 3-year degree, a 3-year program, and end up with a degree in Masters of Public Health and a Masters of Journalism, you successfully combine two kind of not exactly robust areas of career success. And so these are not, neither one of these is or has been until recently a particularly promising career. And the problem is that once the dust settles on this, the opportunities for people who are journalists, good writers, good reporters, and knowledgeable in public health, they're still going to be scant. There won't be very many news organizations with the resources to keep them in. When you look at the networks, what do they do with health? They'll have a doctor. They'll have a doctor who goes to a famine and says, "My God, look at these hungry people. This is terrible." It's not the level of sophistication that the news media are able to support when it comes to public health matters is pathetic. And as a result, my fear is that this kind of specialist expertise, as desperately as the public needs it, we don't have an industry that has places for those people. And that's a serious problem. And maybe what will happen, the philanthropic community, which has really awakened, they're somewhat shell-shocked right now because of market reversals, but they'll get, I dare say, once the dust settles, they'll still have a lot of money. And one of the places they will want to put their money into is encouraging just the kind of journalism you're talking about. So I'm all, you understand, I'm on your side, but I'm simply pointing out the fact that, I don't know how many news organizations in the country have a designated health reporter who does other than consumer health issues.
Right.
Science has not been the cutting edge. Usually when the science stories break, they come out in reputable journals. They've been vetted, and it's just a matter of being able to translate them for a public, not really to do the hard roll up your sleeves work of verification and authentication and making sure that this is actually what it purports to, it says what it purports to say.
You mentioned this earlier in our discussion about this being a terrible time for journalists in the sense that all of the cutbacks in the number of journalists available over the last certainly 20 years, maybe even longer. And the consequences of that at a time when we need so many journalists, we don't have them. And the same thing can be said for my profession, and that's public health. The United States is underfunded public health now for decades. It goes back long before this current administration, although this has been a particularly difficult administration for funding of public health. But go back 30 years, 40 years. When I came to the Berkeley area, the State Department of Public Health was a place that people came from all over the world to look at, because it was the paragon of what a great State Department of Public Health could be. It's still a fabulous department, but its budget for decade after decade after decade has been cut. Amongst the lowest paid professionals in our society today are journalists and public health professionals and teachers, which is a comment. And it's not just the state departments of public health throughout the country that have been cut in this country over decades. It's been the county health departments and the local health departments have been cut as well. We have fabulous people who still go into these professions, journalism and public health, but there are not a lot of them because there's not much money there. So when, I take your point very well, and that is there has to be a market for people who are highly trained in disparate areas. And I'm hoping that this is, as we were talking about, I'm hoping that maybe we can break down some of these silos and maybe there will be a market for these things. We have to rethink.
Right. Well, one of the things that we shouldn't ignore has to do with the origins of the flow of information to the public from public agencies. And I guess what I'm saying is that one of the problems that has arisen and has intensified and is acute in this particular crisis is the people who have information are not necessarily sharing it, even though they are obligated to do so. And the frustration that our reporters find when they're going to public agencies and asking difficult questions, they're not getting the answers. And part of that is there's been a change in the ethos, if you like, of the public information officer in a public agency. That has been really dramatically changed, and it's not wholly Trump's fault. It's been changing over a period of time when public information officers now view themselves as being on the spot and are likely to do themselves more harm than good by giving over the information that they are obligated to provide. So you end up with this practiced ritual of stonewalling and denying information. Now, it's important to remember for our listeners that most of the information that journalists have, they get from somebody in a position to know. And oftentimes those are duly designated officials whose job it is to give them that information. We can't go to an agency of government and sleuth through and find out how many people are doing this amount, this work, or how much money has been spent on that. We rely on public information officers. And there has been a long-term deterioration in the readiness and willingness of people in the public information sphere to provide public information. So one of the interesting things that, and this implicates the scientists as well, scientists should be clamoring and insisting that the people that the scientists who are employed in those public agencies or are working closely with those public agencies have a voice. And they should be saying, look, this information that they're asking you about is something the public needs to know. Let's make sure they know it. So I just wanted a little aside, because remember, the journalists rarely come up with this information themselves. They may get lucky when they find the scientist who happens to know it, or they find the public information officer who happens to be in touch with it, but they are depending on the willingness and the understanding that it is the duty of certain individuals in public information capacities to provide information.
That's
and that
actually
is deteriorated.
It's a very interesting thought that basically resonates with one of the comments we have been getting that was saying maybe we need the scientists directly to publish in the more public media, not just in scientific journals, calling out false information. However, it's actually an interesting thought, maybe also as we're coming up to time, thinking about how things are going forward, how we will be able between journalists and scientists to articulate and to influence the reopening of states, of the entire nation, with this potential dynamic of who's publishing what, where. Do we go to change our modus operandi? Are we focusing more on specific journalists, specific scientists, or are we giving the voice directly to the scientists to go to the public media and publish there? What is your perception of how we can effectively, or should maybe effectively, go forward with the reopening?
This sounds like a John question.
It's becoming pretty clear to my colleagues and me what we need to do for reopening. I think it's becoming also clear to the journalists that I've been speaking with what we need to do. This is not that difficult to understand. We have a tremendous problem, and everybody, I think, understands the problem, and that is that sheltering in place works. If we do not have contact with other human beings, we are not going to get infected. It's as simple as that. The problem is that we can't spend our lives sheltering in place. So how do we find that sweet spot of bringing people back out to have a functioning society and at the same time not exacerbate the problem? Sheltering in place is not going to get rid of the virus. It'll still be out there because not 100% of people are going to do that. So the virus is going to be waiting for an opportunity to spread from an infected person to a non-infected person. So what do you do to stop this? The journalists that I've been speaking with and my colleagues, it's pretty clear. You have a robust system of monitoring so that you have in almost real time, you know exactly the consequences of bringing people out into the workplace. So you let some people out into the workplace. You monitor to see if there's an effect. If the numbers remain low in terms of those getting infected, you let more people out. If the numbers start to go up, you bring people back into sheltering in place. You have real-time monitoring. You don't wait for the hospital beds to fill up and the ICUs to fill up and the ventilators to be used up. You don't do that. At the same time, you assure that there are people that are well-trained. We call them contact investigators and tracers. We have a robust number of people well-trained to act on those people that we identify that are infected, so we can find their contacts, test them. If they're infected, to bring them out of society, put them back into quarantine, into sheltering in place. So we combine those two things. And at the same time, we make certain that we have hospital bed capacity so that we don't let too many people out to allow any kind of surge to take place. So we want to make sure that there's hospital capacity. And finally, we also need to make certain that the people who work in healthcare industries have the necessary PPE. All of those things are critical. And I think there's a consensus now about that.
I think that's terrific. I wish we could bottle that. The only thing I would add is that for myself, I think the important breakthrough is going to be clinical. And unless or until we can reduce the lethality of this disease, we're going to have, it's going to be conceived within a very much more menacing framework that it may need to be. That if we've got some ways to treat people, they don't feel they're dealing with a disease that for many people is fatal, then we're looking at a very different set of options. Yeah. So I'm hoping to see some treatments arise So to change the conversation in a fairly dramatic way.
So maybe as a closing comment from you, Ed, what do you see the role of the journalists in this reopening phase, with the risk of an increase again of the pandemic if we don't do it right? What do you think the journalists' role in this will have to be?
Well, look, I mean, the journalists have a brake pedal as well as an accelerator, and I think that throwing up the kinds of issues that John just raised, which very prudent, very sensible, very orderly. This is the journalists have got to illuminate and give prominence to that kind of thinking in a way that's going to inform decision makers, is going to inform the public, and give them some assurance that there's some logic and intelligence behind the policy responses. Because right now it's kind of a dog's breakfast of options that are being thrown up in ways, and people find bewildering, and they're scared because people are running out of money. So, and we haven't really talked about that, but certainly the kind of epidemiological response John is talking about is one thing. And on the other hand, we've got to do something about our social safety net, because people are now, we don't even know. I couldn't tell you right now what opportunities people have to get treatment if they don't have their health insurance anymore. I don't even know what is being done as a practical matter. And I'm sure there are millions of people out there who also don't know what's going to happen to them if they turn up at a hospital and they don't have their health insurance because they've been laid off. So anyway, so the purpose, the role of the press that you asked about is to, when necessary, put on the brakes and to try to illuminate the more thoughtful and the more helpful policy options, and to continue calling attention to the people who are suffering disproportionately and unduly from this contagion.
And you, John, from a scientific perspective, what do you think the role of scientists will be in this reopening in conjuncture with the journalists and the provocative thought of picking up the keyboard and actually posting potentially themselves their opinions directly with the public media? What do you think the role of the scientists is?
The role of the scientists, I think, is to inform public policy and to work with journalists to get the science message out. The role of the scientists, of course, is to try to discover those therapeutics that Ed was talking about, and even more importantly, perhaps, to discover a vaccine to prevent people from getting infected. So science obviously plays an enormous role in this pandemic, but its role, it can't be isolated. What science is doing has to be adequately communicated to the public, and the public can help inform science as well in terms of a positive feedback. So we're all in this together. I feel in the short run, we've got enormous challenges, but we do have tools to handle those challenges. And I think in the long run, we're going to be a much better society from the consequences of this.
Well, thank you very much. We have come up to time, so I really want to thank you both for this very enlightening and inspirational discussion. I took away a lot from it. The comments that we've been getting show that people have been quite engaged in the discussion, and apparently have been able to get something out of it. I hope that there was a learning experience available to everybody, to our audience, and that everybody was able to build up more judgment and maybe to have a finer vision and perspective on what is coming and how to consume these informations that are coming from through journalists, from scientists, as well as policymakers. For us, this was a very engaging event. I want to thank you very much again for having taken off your very, very busy schedule this time to share with everybody and to spread the message, to educate. I want to also say kudos and thank you to the organizational team, the ETS team, the custom program team from Berkeley Extension, who made all of this possible. It's very exciting for us to be sharing these events, and I hope everybody will be tuned in to the next Berkeley Conversation events as well. Thank you very much for your time, and I wish a wonderful day and rest of the week to everybody.